I want you to think about something right now. You have probably felt it. That vague sense of tiredness that does not match your activity level. You slept 8 hours and woke up exhausted. You have not done anything strenuous, yet by 2 p.m. your energy has completely evaporated. You have mentioned it to your doctor. You have maybe done some basic blood work. Everything came back normal, so you have accepted it as the cost of getting older. Here is what I need you to hear. That exhaustion may not be aging. It may be a signal that your kidneys are beginning to fail quietly, and nobody has explained to you what to actually look for because standard lab work misses it almost every single time. My name is Dr. Franklin. I work in preventive health with a focus on the systems in your body that decline silently in older adults. Systems that send signals you have probably been ignoring because you did not know they mattered. Your kidneys are one of those systems, and today I am going to walk you through 3 specific warning signs that appear years before kidney disease becomes obvious. Signs that your doctor may have heard but never connected to your kidneys. And most critically, I am going to tell you which screening you need to ask for specifically, because it is the one that catches what standard tests miss. Before we go further, I want you to do something. Look at your hands right now, your fingernails specifically. Notice the color at the very base near the cuticle. Keep that in mind because we are going to come back to it in a moment. And if this is the first time you are hearing about kidney warning signs that actually matter, hit subscribe now, because what I am about to explain could change the trajectory of your health in ways that a standard physical will never catch. Let me start with something that most people do not understand about kidneys. Your kidneys are not just filters. That is the oversimplification that most people carry their whole lives. Your kidneys do filter waste products from your blood, yes, but that is actually a small fraction of what they do. Your kidneys regulate the balance of electrolytes in your bloodstream, the minerals that control how your heart beats, how your muscles contract, and how your nervous system communicates. Your kidneys produce a hormone called erythropoietin that tells your bone marrow to make red blood cells. Your kidneys activate vitamin D, a nutrient that is essential for bone health, immune function, and neurological health. Your kidneys regulate your blood pressure through complex hormonal pathways. When your kidneys begin to fail, it is not just your waste clearance that suffers, it is all of these systems simultaneously. The result is that kidney disease in its early stages does not present as a single obvious symptom. It presents as a constellation of vague signals that feel disconnected from each other, and people attribute them to aging, stress, or various other causes, while the root problem goes undetected. Now, here is the critical piece of physiology that makes this dangerous. Your kidneys have enormous functional reserves. You have 2 kidneys. You can lose function in one kidney almost entirely and still maintain adequate overall kidney function. You can lose 50% of your total kidney function and feel almost completely fine. No pain, no dramatic symptom, nothing that would make you suspect something is wrong. This is why kidney disease is called the silent killer. By the time you feel truly unwell, the damage is often advanced. What this means practically is that early detection requires looking for warning signs that most people dismiss as unrelated complaints. Here is warning sign number 1. Unexplained anemia, low red blood cell count, and the specific way it presents in older adults. Most people think of anemia as a woman's issue, something that happens with heavy periods or iron deficiency. But anemia in an adult over 60 without obvious blood loss is almost always related to kidney function. Here is why. Remember that hormone I mentioned, erythropoietin? When your kidneys are working well, they sense when your red blood cell count drops even slightly. They respond by releasing erythropoietin. That hormone tells your bone marrow, make more red blood cells. This happens constantly, day and night, maintaining your red blood cell count in a healthy range. But as kidney function declines, even before it becomes severe enough to be clinically obvious, erythropoietin production falters. Your bone marrow stops getting the signal to make new red blood cells at the rate it should. Your red blood cell count begins to drift downward. Slowly, quietly. The anemia of chronic kidney disease is not sudden. It is insidious. It develops over months and years. Your body adjusts. You do not notice a particular moment when something changed. What you notice instead is a general sense of exhaustion that seems disproportionate to what you are doing. You have always been able to walk a mile without thinking about it. Now you feel winded. Climbing stairs leaves you breathless in a way it did not used to. Your mind feels less sharp. That fogginess that you thought might be early cognitive decline, that vague mental slowing, often has nothing to do with your brain. It has everything to do with oxygen delivery. When your red blood cell count is low, your brain is not getting the oxygen it needs to maintain full cognitive speed. The dangerous part is this. When people feel that mental fog, they often panic that it might be dementia. When they feel that exhaustion, they assume they need more sleep or that they are depressed. They see a primary care doctor who orders standard blood work. And standard blood work includes a complete blood count, which will absolutely show if you have anemia. So you get diagnosed with anemia. You may even get iron supplementation. But here is what you do not get. You do not get asked whether your kidneys are the cause of that anemia. Because anemia has many causes, and iron deficiency is the most common, iron supplementation seems logical. And it will help if you actually have an iron deficiency. But if your anemia is from kidney disease, if your kidneys are not producing enough erythropoietin, iron supplementation alone will not solve the problem. Your red blood cell count will improve slowly, if at all. The exhaustion will persist, and the kidney disease will keep progressing silently while everyone is focused on treating the anemia symptomatically without addressing the root. What you need to ask for specifically is this. If your blood work shows anemia, ask your doctor directly. Is my anemia from iron deficiency, or is it possible my kidneys are involved? Request an assessment of kidney function at the same time. An eGFR measurement, estimated glomerular filtration rate, which tells you what percentage of your kidney function remains. That simple question and that one additional test can completely reframe your treatment. Here is warning sign number 2. Persistent high blood pressure that is difficult to control, even on medication. Most people think of high blood pressure as a risk factor for kidney disease, and that is true. Chronic high blood pressure over decades can damage kidneys. But what most people do not understand is the reverse. Early kidney disease causes high blood pressure. It is one of the earliest signs that your kidneys are beginning to struggle. Here is the physiology. Your kidneys regulate blood pressure through multiple pathways. One of the most important involves blood vessel constriction and relaxation. When your kidneys begin to fail, they become less efficient at balancing sodium and fluid in your bloodstream. Fluid accumulates. Blood volume increases. Your heart has to pump harder to move that extra volume. Your blood vessels constrict more than they should because the kidney's normal regulatory feedback is becoming impaired. The result is elevated blood pressure, often moderately elevated, not dramatically high, just persistently above what it should be for your age. Now the tricky part. Most people on blood pressure medication are aiming for a reading around 130/80 or lower. If your blood pressure is staying in the 140 to 150 range, despite being on 1 or even 2 blood pressure medications, that is a pattern worth investigating. Because that pattern, medication-resistant hypertension in an older adult, is one of the most commonly missed early signs of kidney disease. People assume their blood pressure is just hard to control. They get another medication added, the dose increases, and everyone is treating the symptom while the underlying kidney dysfunction progresses. What makes this more complex is that some of the blood pressure medications that are prescribed most commonly can actually mask kidney disease or even accelerate it if used improperly. ACE inhibitors and ARBs, the medications we discussed in my previous video, can temporarily improve kidney function in early disease by reducing the pressure inside the kidney blood vessels. So your blood pressure comes down, and your kidney function actually appears to improve on your lab work. That can create a false sense of security. Your kidneys continue to decline at the tissue level, even while your lab numbers suggest you are being managed well. What you need to ask for specifically is this. If your blood pressure is difficult to control despite medication, ask your doctor for a comprehensive metabolic panel, specifically including creatinine and eGFR. Do not just ask whether your kidney function is normal. Ask what your actual eGFR number is and whether it has changed from a year ago. That trend matters more than a single number. If your eGFR has declined by more than 3 to 5% per year, that is a pattern of progression that your doctor needs to address specifically. Here is warning sign number 3, the one that surprises people most when I bring it up. Muscle cramps and muscle weakness that seems to come from nowhere. You are lying in bed and suddenly your calf tightens into a cramp that wakes you up, or your legs feel weak and tired in a way that does not match your activity level. You have blamed it on aging. You have blamed it on electrolyte imbalance from heat or exercise. You have considered vitamin D deficiency, but you have probably never connected it to your kidneys. Yet, in an older adult, persistent muscle cramps and weakness are one of the most specific early signals of kidney disease. And the physiology is straightforward once you understand it. Your kidneys regulate electrolytes, minerals like sodium, potassium, calcium, and phosphorus. These minerals do far more than just sit in your bloodstream. They control how your muscles contract. They regulate nerve conduction. They maintain the electrical environment that your heart depends on. When your kidneys begin to fail, they lose the ability to regulate these minerals precisely. Calcium levels drift downward. Phosphorus accumulates. Potassium can become unbalanced. Some of these changes happen early, before your overall kidney function numbers look obviously abnormal. And muscle tissue is exquisitely sensitive to these changes. The cramps often start in the legs, particularly at night. They can be intense enough to wake you. You may stretch, walk it off, and fall back asleep thinking nothing of it. But if this is happening multiple times per week, if your legs feel persistently weak and heavy, particularly by late afternoon, or if you are experiencing a sensation that physical therapists call restless legs, an uncomfortable urge to move your legs when you are lying still, these are all muscle manifestations of electrolyte imbalance. And in an older adult, electrolyte imbalance is kidney disease until proven otherwise. The other physical sign that can accompany this is swelling. Not the dramatic swelling of a sprained ankle, but a subtle puffiness, particularly in the legs and around the ankles. You notice your socks leave deeper marks than they used to. Your shoes feel slightly snug by late afternoon, even though you have not eaten anything unusual. That puffiness is fluid accumulation. Your kidneys are not filtering sodium and managing fluid balance the way they should. Fluid is accumulating in your tissues. The swelling often improves slightly if you elevate your legs or rest overnight, but it returns during the day as your kidneys continue to struggle. Now, I need to tell you something that is genuinely important. If you suddenly develop significant muscle weakness, if you feel dizzy or faint, or if your heart rate becomes noticeably irregular, these are not slow signs. These are urgent signs. Severe electrolyte imbalance, particularly high potassium, can affect your heart's electrical system. This requires immediate medical attention. Call emergency services if you experience chest pain, fainting, or a heart rate that feels dangerously fast or irregular. Do not wait. But persistent mild muscle cramps and that everyday muscle weakness, the kind that makes you feel like your legs are tired no matter how much you rest, those are early warning signs. Those are the ones that almost nobody connects to kidneys. What you need to ask for specifically is this. If you have persistent muscle cramps or muscle weakness, ask your doctor for a comprehensive metabolic panel that includes electrolyte measurements: sodium, potassium, calcium, and phosphorus. Do not just ask whether they are normal. Ask what your actual numbers are. A potassium level of 5.0 is technically in the normal range for most labs. But for someone with declining kidney function, a level trending upward even within the normal range is a pattern worth addressing before it becomes dangerous. Same with calcium and phosphorus. These minerals need to be in balance relative to each other. A single snapshot does not tell the whole story. A trend over time does. Now, let me put this together for you. You have these 3 warning signs: unexplained anemia and exhaustion, blood pressure that is difficult to control on medication, persistent muscle cramps, and weakness. None of these are rare in older adults. Many people experience one or more of them and attribute them to aging or various other causes. But when all 3 are present, or even when two of them are present together, the likelihood that your kidneys are involved becomes very high. Here is what happens to people. They go to their doctor. They mention the fatigue. Maybe they mention the muscle cramps. The doctor orders basic blood work, complete blood count, basic metabolic panel. The basic metabolic panel includes a creatinine level, which is used to estimate kidney function. The result comes back, and the doctor says, "Your kidney function looks fine," and everyone is reassured. The problem is that creatinine is a terrible early marker of kidney disease. Creatinine only rises when you have lost a significant amount of kidney function, 30 to 40% or more. Before that point, your creatinine can be completely normal, while your kidneys are already in significant decline. This is why eGFR is so much more sensitive. eGFR accounts for your age, your sex, and your race in calculating your actual kidney filtration rate. It catches decline years before creatinine becomes abnormal. But here is the thing. Many primary care doctors do not routinely calculate eGFR unless they are specifically looking for kidney disease. If you have a creatinine of 1.1, which is technically in the normal range, your doctor may not bother calculating the eGFR. And if you have declining kidney function, that eGFR calculation could show you at stage 2 or stage 3 chronic kidney disease, while your creatinine still looks fine. So here is your action plan. This week, if you experience any combination of these 3 warning signs, call your doctor. Tell them specifically, "I have been experiencing persistent fatigue. I have been noticing muscle cramps, particularly in my legs. I want a comprehensive kidney assessment. Ask for eGFR specifically. If your last eGFR was calculated more than a year ago, ask for it to be recalculated. Ask whether your creatinine and eGFR have changed from previous years. Bring any old lab work if you have it. Trends matter far more than individual numbers. If your blood pressure has been difficult to control, mention that directly. Tell your doctor, "My blood pressure remains elevated even on medication. I want to understand whether my kidneys might be involved." Request not just a blood pressure reading, but also a kidney function assessment at the same time. If muscle cramps are part of your pattern, ask for electrolyte levels: sodium, potassium, calcium, and phosphorus. Ask your doctor to explain what your numbers are, not just whether they are normal. And here is something most people do not do but should. Ask your doctor whether your kidney function has declined since your last visit. Do not just accept a statement that everything looks fine. Ask for the specific number. What was my eGFR last year, and what is it today? If it has declined more than 5% per year, that is a pattern your doctor needs to address specifically. One more thing. If you are taking blood pressure medication, NSAIDs for pain, or have diabetes, your kidneys are at elevated risk. These are the most common things that accelerate kidney disease in older adults. If you fall into any of those categories, and you have any of these 3 warning signs, the conversation with your doctor becomes even more urgent. The critical thing I want you to walk away with today is this. Kidney disease progresses silently. It does not announce itself until it is often quite advanced. By the time someone feels truly unwell from kidney failure, irreversible damage has often occurred. But caught early, when you still have 40, 50, 60% of your kidney function remaining, the progression can be slowed dramatically. Some people can stabilize their kidney function for years, or even indefinitely, if they catch it early and manage it properly. That window of opportunity closes the longer you wait, and that window remains open only if you know what to look for. Do not accept vague reassurance that your kidneys are fine based on a single normal creatinine. Do not assume that your exhaustion is simply aging. Do not dismiss your muscle cramps as a random symptom. These are signals. Your body is communicating something specific. The question is whether you have the information to understand what it is saying. If this video helped you, please share it with someone you know who has been experiencing any of these symptoms, because the person who needs this information most is often the person who has been quietly suffering alone, assuming these are just the inevitable consequences of getting older. You now know better. Make sure you are subscribed and hit the notification bell. My next video is going to cover something that most doctors never discuss: the one dietary change that slows kidney disease progression more reliably than any medication. That is information you will not want to miss. Before you go, tell me in the comments, which of these 3 warning signs have you been noticing in yourself or someone you know? Be specific. Your answer could be the conversation that someone else needs to have with their doctor this week. I read every comment. Your experience matters here. Take care of yourself.